Hello, and welcome to another episode or part 3 of the series of oral placement therapy. Today we are going to cover 3 components of it: tongue tip lateralisation tool, jaw grading bite blocks, and infant toothbrush. Starting with the infant toothbrush, it usually has on the front side bristles and it has some texture on the back side. The 3 main functions that it helps in are tongue lateralisation, that is movement of the tongue towards the sides for mixing of food with the saliva, biting, introduction of that and facilitation, and finally oral sensory stimulation so that the child is comfortable not only with the introduction of brush in the mouth but also for different food textures, spoon, etc. Tongue tip lateralisation tool, though it says lateralisation, has 2 functions to perform. First is lateralisation, using it as a T where you need to slide the tongue sideways, and up and down, or elevation and depression of the tongue, where you'd slide the tongue up and down along it when it is placed in a longitudinal position. This is a very important tool when you have to work with sound, so lingual sounds related to your tongue. As far as feeding goes, it helps in the mastication of the food or the chewing of the food, mixing it with the saliva as the tongue movements go. The third tool for the day is known as jaw grading bite blocks. There is a graduation of them where block number 2 is of 5 mm. With every block, there is a 0.5 mm graduation and increase in the width. So they are very important if the person has dysarthria or unclear speech and dyspraxia where the fluency of the speech is affected. It helps in improving a function known as high to low jaw position. So opening of the jaw is something that it works on. So it also helps in improving jaw strength, like a symmetrical jaw strength on both sides. You can practice them together or individually, and for improving jaw stability if the jaw is weak. This particular function is performed by biting onto the jaw grading bite block and holding on each side individually, or you can also do it together. The second component would be to try to pull the bite block out of the mouth so that it is an isometric kind of resistance where you're trying to hold it in while the other person is trying to move it out of your mouth, and the hold should be there for about 15 seconds. This can be used in midline also for jaw stability. For initial checking of the bite block, try to hold piece number 2 maybe for 5 seconds and see if the person is able to hold the resistance. Then you can move on to number 3, number 4, and so on, depending on till the person can reach number 7. 2 kinds of jaw grading bite blocks are available. There is purple and red. So what is the difference here? The purple one is more sensory friendly because it has a softer surface, while the red one is a bit harder. So this movement control can be attained in people who might have stroke, any instability of the jaw or the joint of the jaw. So jaw sliding might occur in some people when they're trying to feed while they're talking. So it is really beneficial over there. Or any kind of sound that is produced while opening and closing of the jaw, which is called as crepitus, can be controlled with it by improving jaw strength. I hope this was informative for you. Please mention in the comments below. Please continue with our series of oral placement therapy where we still have part 4. We'll meet again soon. Bye.